Welcome to the ANF Academy podcast. My name is Thea and I'm your host. In this episode and every other episode, I'm interviewing therapists worldwide that use ANF therapy in their practice to help people with various types of pain and injuries. If you're diagnosed with certain condition or you have a persistent or recurring pain and you already tried everything and nothing helped, I recommend watching this podcast. Hi, Brian. Welcome to the ANF podcast. Nice to meet you finally. I heard such great things about you. How are you doing?
I'm doing very well. I appreciate you taking the time to put this together.
I announced you as a clinical massage therapist and neurokinetic therapist. So What is that you do? What people need help you with when they come to your practice?
Oh, I see the whole entire gamut. I get people from athletes to children to people who are just in pain. And like recently, I just worked with an old man who had post-herpetic neuralgia. So that's a nerve inflammation that you receive after shingles. And a lot of times when you're in your 70s, it's medically incurable. Within one treatment, it was 50% better. I have it all on video too. I videoed that. Happy to send that to you. And he just had a second treatment. He left here with no pain.
How do you choose? What modalities do you use in your practice? And how do you choose when you have a patient?
Depending on what issue they have. You know, like if it's an athlete or it's somebody that's sitting at a desk all day and it's like a repetitive motion injury, sometimes I do some muscle testing. But I would say 80% of the therapy that I use is ANF. By far the most effective. I do use FSM too, but I find that's not as fast. I sort of like efficiency. People would prefer to heal as quickly as possible. So I find that ANF delivers those type of results.
You said in 80% of the cases you use ANF. Why is that?
Because when people are in pain, that's inflammation. And so if you can remove the inflammation, you remove their pain.
So when they come and ask what those patches are, what do you say? Because I feel like it's a little bit challenging to explain.
I mean, I don't tell them right away. Because I'm not putting anything in their head. Like people come to me, I have them lie down, and obviously I ask them what they have going on. And so if somebody says, "Oh, I have shoulder pain and I can't really lift my arm without pain," I'll sit them down and I'll start to palpate their shoulder and I'll try to figure out where the inflammation is. And I don't tell them really what I'm doing because they're coming because they trust me. Usually it's I get a lot of referrals. So I'll start feeling around to try to discover where the inflammation is. And then that sort of determines where I'm going to put the ANF discs, and then I'll place the discs. So for example, I actually have them on myself right now. I have shoulder pain, so I'll just figure out where the pain is. I'll put the disc, and then within usually 2 to 4 or 5 minutes, the pain is down from a 6 to an 8 all the way down to 2 to gone. And then once you get all the inflammation sort of resolved, then they can actually start to move their shoulder again without pain, and the nervous system won't guard as much.
How many treatments usually? I know it depends on the injury and pain and how the body is. Like we are all different, but on average, let's say shoulder pain, how many treatments are needed to be completely resolved?
1 to 3 treatments, depending on, obviously the nature of the injury. But a lot of times I find, with just 1 to 3 treatments along with physical therapy.
Do you have those people that already tried everything?
Oh, yeah.
Before
Yeah, I get a lot of that. A lot of people, they come in discouraged. They're like, okay, I'm going to try this one last thing, and then boom, that's the, I think it's their motto, right? When nothing else helps,
Nothing else. Yes.
And I actually use that too. I use that as part of my marketing.
I saw your social media and I saw that you treated several people with fibromyalgia.
Yeah.
Because conventional medicine says there is no cure and you have to live with it till the rest of your life. So can you tell us a little bit more about your results? And
I get really good results. It requires a little bit more patience. And so it can get a little expensive, but I do work with people financially, I offer packages, and if I don't always have to make a large profit on something, sometimes I'll just do it at cost. And a lot of times I give it away. But you can't do that with everybody, obviously. So with fibro, I find that it can resolve pretty quick. And ultimately what I found fibromyalgia to be, it's spinal cord inflammation. And so their whole nervous system's sensitized because they've just got chronic inflammation along the spinal cord. So I'll treat, the spine at different levels. And then I'll also check the nerves coming from like the transverse process of the spine. Sometimes, their shoulders will be inflamed. Because inflammation spreads. So it's not going to just be in one spot when you have fibromyalgia. You're going to have pain all over your body. But I find I get the biggest results when I treat the spine.
Can you talk a little bit more about fibro? Because usually, most of the time, people are misdiagnosed with arthritis or something similar.
Yeah.
So how one know do they have fibro?
Well, that's tricky because, like you said, it's so hard to diagnose. So I follow particular protocols. And so if I find that they feel better after that, there's a good chance that, yes, that's what they have.
Based on what I know, inflammation spreads because of stress, lots of sugar, pollution, radiation.
Yeah.
What would you say is the main cause of inflammation? All of this?
Yeah, poor lifestyle, lack of exercise, poor eating habits, not getting enough rest, not drinking enough water. All those things are contributing factors. And so that's what I do. Actually, it's funny you say that. I do when people come in, I'll get the pain to come down, but then I'll tell them what they need to do. And not everybody likes to listen to that. Not everybody wants to change their diet, stop eating so much sugar because they're addicted to it.
But can they still have results if they don't change the lifestyle?
Yeah, they do. They do until it comes back because they haven't changed anything. So I find that you sort of have to change things up a little bit.
Can inflammation resolve on its own if we change lifestyle and back to exercise, change our diet? Or
will it resolve on its own?
Or our body also needs like additional support.
It can. It can. I've had times where the discs will work, but then I'm not getting the exact results. And those are the cases that I find that they need physical therapy and they need exercise. So the combination of physical therapy, and it doesn't have to be anything crazy. They can just do some light exercise just to start moving again. I find that with the ANF therapy and sometimes some medical massage, it's so effective. It really helps.
Everyone are saying how physical exercise is important, but what actually happens in the body when we are exercising?
You're just obviously you're strengthening up all the muscles that are weak.
Let's go a little bit deeper besides that, because we say it helps us fight.
It helps stress relief.
Okay.
It helps to release endorphins, increase serotonin,
lower cortisol.
Yeah, you need to put a little bit of stress on the body so that those mechanisms will start to increase to help strengthen everything. Nerve signalization. If you're not moving, you're not doing anything, everything starts to weaken. Were
there any conditions that you were unable to treat before you implemented ANF?
I would say most of them.
Really? What does that mean?
Massage and exercise. Yeah, I got good results, but I would say 40 to 50%. Like, you can help, and things can take a long time. With ANF is there's nothing like it. It'll take something that would like for a sprained ankle, for example. You sprain your ankle really badly, it's going to take you. It could take you months to get back to normal. When I use ANF, it's like 2 to 3 treatments, and you're 2 weeks, you're done.
As I know, ANF helps with different body systems, right? So, for example, when I go through a social media of a physiotherapist and they talk about prescribing exercises to their clients, if there's something deeper that has to be resolved, they just send their patient to a practitioner that does that. But with ANF, you can do much more than just prescribe an exercise and apply a device on them. So what you can do as an ANF therapist?
Really, it's I do what's in my scope. So if somebody comes in and their immune system's lacking, like I've got a couple reviews of people that just couldn't get over the flu. They're like literally sick for a month. I'll just do the immune system protocol, and strengthen their immune system. I use it with my children if they're not sleeping well. If I have clients that aren't sleeping well, I'll use the protocol for sleep with melatonin discs and treating the pineal gland. That works miracles. I've got a whole slew of clients that I send discs to for sleep. They can avoid the office visit. I just send them some discs. All kinds of things, Yep.
Can you share at least one story that even made you speechless?
So I had a woman, she had come in with frozen shoulder, and she had it for 3 years, and she tried everything. She had surgery on it where they broke up the capsule. She's done physical therapy. She had injections. She tried everything. And when she came in, I was feeling her shoulder, and there was literally no inflammation in her shoulder to speak of, like nothing hurt to touch. And so then I put some discs on her liver, and I learned that trick from Dr. Mikkel because, in Chinese medicine, the liver can relate to the right shoulder, and then your kidneys and adrenals can relate to your left shoulder. And so so I put five or six discs on her liver, and within 2 minutes, she had full range of motion. So it just shows you the relationships for your organs, to your muscles, and to different body parts. It's all about the priority systems.
Like a main difference between ANF therapy and, let's say, conventional medicine, that you see as a body as a whole, as one interconnected system.
Exactly. Yeah, I do. They don't, with medicine, it's just treating symptoms. It's not really getting to the root of an issue. So while it has its place, it's just, for every medication you take, you have 6 more symptoms. Mm-hmm. You're always chasing symptoms with more medication. Yeah, I prefer to do things the natural way. And I think most people are coming to that. They're just tired they don't want to take medications. They're done. And so I just find with the ANF, it just helps to resolve things much faster naturally.
So can you just explain how ANF treatment looks like?
When somebody comes in, I just ask them, what their main problem is. A lot of times it's more than one thing. And I just start chipping away at it. I find the inflammation with my hands.
Okay.
And I make the inflammation go away with the discs. It's amazing. So, I'm sure maybe you'll send some of the client testimonials that I've sent to you. It's just it delivers results where nothing else does. Like especially with the elderly, because they want to enjoy the rest of their life not in pain, and the discs just deliver that a good amount of the time. Obviously if something's bone on bone and your ligaments are shot, it can help a little bit, but it may not deliver the results that you desire. You might need surgery, But I find, again, then with that, I have protocols for surgery to help speed up the healing process and normalize healing.
Where do you see ANF in the future?
I just can't believe more. Everybody says to me when they come in, they're like, how come more people aren't doing this? And I'm like, it's not the easiest therapy to use. It just takes time to develop your palpation skills. And you need to understand the nervous system and, the interconnectedness with fascial chains and kinetic chains. Like I find that understanding with palpation skills, it gives me the results that I desire.
Do you have something to say to those that are your peers and they may heard about ANF or never heard before about joining education and using ANF in their practice? Like, do you have a message for them?
It's going to increase your business tenfold because, around me, like I've had therapists calling. They're like, are you hiring? Are you hiring? Because everything's so slow for them right now with the economy in the U.S. That, people that are doing just massage, they're not really staying as busy as they want to be. But I'm slammed because everybody's in pain, and you resolve things so quickly. It's like one of the best tools you could possibly put in your toolbox as a therapist, whether it be a physical therapist, as a chiropractor. I've got nurses that have started the education. Like when I see a practitioner, they come to see me for pain relief. I'm like, I try to convince them, like, you should really do this because you'll increase your business and you'll get results that were like beyond your wildest expectations. Because I've seen what it can do. I've worked with Mikkel, and he came to Florida for like 2 weeks, and I literally did like 4 levels all in like a sitting. And what I saw him do with people, blow your mind. I was convinced it worked. I know it works. It was just a matter of getting good at it. And so it requires a little bit of patience. You need to kind of study the nerves. You need to know where the nerves are and just palpate. Don't be afraid to try. Don't be afraid to fail, because eventually you're going to get good at it.
Do you have a message for those that are actually at the point that they tried everything? They have like a recurring, persistent pain, or they have issues such as polycystic ovaries, fibromyalgia, and similar conditions that conventional medicine doesn't have an answer for? Yeah,
I would say give ANF a try. And for the really serious conditions, it can take a little bit of time and patience, and find a good practitioner that can help you, Can it help only with managing symptoms, or can actually cure them? No, it removes the inflammation so that your body can heal. That's the root of it. Inflammation is at the root of disease. And so if you've got this inflammation, it doesn't allow for the cells to regenerate. Mm-hmm. So if you remove the inflammation, cells can regenerate. When people have degenerative disc disease, acute or just long-standing tendinitis, things start to degenerate because your cells aren't regenerating because of the inflammation. So you remove the inflammation, you can heal of mostly anything.
But if they don't change the lifestyle, problems will come back.
That's right. It's a multifaceted approach. You have to get enough rest, eat well, stay away from sugar, exercise, and then I find with just ANF therapy, it helps to speed it up 50 to 90% faster, at least.
Just one last question.
Okay.
So, for example, if I come to you and I have a shoulder pain, and then you manage to reduce my pain for, let's say, 50% at the first session, and then the next few days I already feel even better, and I want to go to the gym, will I slow the process by doing that?
I tell people to avoid the gym just while we're doing the treatment. Whether it takes a week to 2 weeks, you can take 2 weeks off. That's what I tell people. Like, don't push it just because you feel better, because your body needs time to heal. It's not magic. It's science. So, just because you feel better doesn't mean you've healed. I tell people, even if you're not feeling pain, at least come back for a quick 15-minute session just to let me reassess and make sure the inflammation's gone. Because if you've invested already the time and money into this, you want to just complete the process. You don't want to have to keep coming back. So, yeah, I would say take time to rest.
Okay, Bram, thank you for this.
Yeah, it was my pleasure. It was so nice to meet you.
Nice to meet you too. Hope you enjoyed.
Right. Thank you so much.
Have a great day and have a great weekend.
Yeah, you too.